that is being selected to be prescribed for the patient. Each medication, when it comes to formulation, might have an active ingredient and might have other excipients, which will make this medication unique in its formulation as well. We will not go into that direction, but you will be seeing shortly different preparation or different ways where the medications can be served in different shapes or different preparation, but at the end of the day, they're all serving the same purpose or has the same active ingredient. It's all about the formulation and how you can design it. That's what will make the difference. So the administration route is used to give the medication or the selection of the medication route that you will give the medication with will depend on three things. First of all, what is the condition that you are treating and which part of the body that you are focusing on your management. For example, certain conditions or certain diseases, you would need a systematic therapy. So systematic therapy means sometimes you might need to give something that in an oral form or in an injectable form. In other situations, the kind of infection, for example, is just limited to a topical or to an outer side of the body. Then in that case, you probably need only a topical preparation. So this is what we mean by the part of the body that is being targeted. The other thing is the action of the medication that you're intended to. So in certain conditions, you want really to have a localized effect, and that can be achieved by using an appropriate dosage form that can exert its effect on that particular site of the body. That can be by ingestion, or it can be by administration of IVs, or it can be a topical administration as well, but it will be focusing only on that site of location. The other thing and the last thing is the formulation of the medication. Would this formulation serve that intention or that action, and would it produce that action as you are intending to? So here are very common route of administration, and probably this will not cover everything, but those are the common terminology that you probably have already or already know about, and probably some of them could be new to you. So Buccal, and I will go and explain more when we reach to each one separately, but Buccal, for example, it's an oral dosage form. Enteral, so enteral, any idea? Excellent. So enteral and parenteral. So enteral, usually it's the direct administration to the GI or to the gastrointestinal system, where the parenteral, it will be the administration through the veins. Inhalation, it's clear from its terminology. Infusion, and I will explain more on that. Infusion basically is one of the parenteral formulation. When it comes to intramuscular, intrathecal, intravenous, and subcutaneous, all of these we will call them parenteral. So the parenteral formulation can be different based on the technique of the administration and the site of the administration. The other route of administration or another set of administration could be nasal administration, ophthalmic, directly to the eye, the oral, which is the most common probably between oral and IV. The otic is directed to the ears, the rectal inserted into the rectum. Sublingual, it's one of the oral dosage forms, but it will be placed under the tongue. And the topical here could be something applied to the skin, or it will exert an effect as a topical action. For example, one of the medications that we use for antacid, or as an antacid, we use a medication called sucralfate. Sucralfate basically will cause a layer in the stomach that will form like a topical protection to the GI mucosa. So that's kind of a topical type of action. The transdermal, it's anything that would be applying a medication from the skin into the inner side of the body, but it's through the skin basically. And here it's, for example, applying a patch, or sometimes applying a specific type of cream or ointment that will exert its effect through that route. So before we go into the depths of each type, I would just brainstorm with you very quickly. What would be the actions that you might be looking for, or you might select your medications to exert? Now, we know that there are different routes of administration, so by common sense, you will select the most appropriate for that condition. Like for asthma, we use inhalers. For systematic infection, bacteremia, for example, we will use a parenteral administration. But sometimes you would select certain, or you would like to have certain features or certain actions exerted by the medications or made up by the medication to produce a special effect. For example, you want a medication that achieves a rapid onset of action following its delivery. So any idea what could be a medication? What could be the route of administration that may exert a direct and immediate and fast? Excellent. So that's one of the examples. To mask the undesirable taste or offensive odor of a drug substance. Okay, so the capsules will be the oral dosage form, but yeah, that's very close. There are other kind of formulation that we call it coated. We'll explain more about it. So it's going to be designed in a way that the medications that will be the inner part or the core part of the medication or the formulation, and then there will be an outer layers which will mask the taste or the odor of that medications. Granules also can be one of the form where medications properties will be masked, like the taste and the odor as well. To provide the drug products in a stable, effective, and safe for consumption after a specific or until a specific storage condition or suitable storage condition. So basically, certain medications are very unstable. Their physical and chemical property, they are unstable. They will be turned into inactive ingredients shortly after, if they are, for example, affected by humidity or affected by other environmental factors. So those will be designed in a way that it will be activated only when it's needed to be administered or at the time of the administration. Any ideas, something like that? Okay. At the end of the lecture, I will share with you some of the examples. But keep that in mind that these are some of the reasons why we will select certain formulation for certain medications. The next one is to protect the medication from a destructive influence of gastric acidity, and especially if you want, when you want the medication to reach to a specific location or part of the intestine, for example. We know that some medications, when it comes to metabolism, some medications, they will pass through something called first pass hepatic metabolism. So they go through certain hydrolysis and kind of changes where if they pass through this mechanism, that this will cause a destruction of the medication property. So it will not exert its effect by the time it reaches to certain location in the body. In order to avoid that, or to protect the medication from, or the active ingredient from being subjected to this effect, certain medications will be formulated in a way that they change their pH, they change its formulation, the layers that are covering this medication in order to be released, or releasing the active ingredient only in certain locations, so it will pass all of these kind of destructive mechanisms. And I will show you some examples about that. The next one is to provide a medication with a predetermined rate and prolonged effect. We all hear about a medication that can be given once daily, others can be given twice daily, something can be given once a week, for example. So where is this coming from? Some of them is related to the pharmacokinetic of the medication, that it has a long half-life, and until it's being cleared from the body, it will take a long time. But others are designed in a way or in a formulation that can release the medication slowly throughout the day or throughout the period that it's designed to. We do have several kind of medications that falls under this category, and I'm going to share some examples with you. Any idea what do we call these formulations? Excellent. Okay, so the next one is to provide useful dosage forms for administering poorly water-soluble or insoluble medications in an appropriate vehicle. So some medications, their properties are they are insoluble and need certain solvent or diluent to be diluted in, and then they can exert its active effect. That can be a limitation sometimes when you want to produce a medication. So you try to design it in a way that it stays in a format, kind of a prodrug, we call it, where it will be only activated whenever it's being mixed or prepared in certain ways. So example of that is like antibiotics, for example, the powder antibiotics. Sometimes the powders, in general powders, they tend to protect the medications, or when you formulate it into a powder formulation, those medications will stay stable for a certain time until you dissolve it and intend to administer it at that time. The last one is to provide a sterile, clear, and particulate-free liquid dosage form of a substance. So any idea which route of administration should be sterile? So sterile means it's particulate-free, it's pyrogen-free, and this medication it's free from microorganisms and is sterile. It went through a sterilization process.
The arterial one?
Mm-hmm.
The arterial one?
Okay, the intravenous. Those when it comes to intravenous medications, what other liquid dosage forms that needs to be sterile? Okay, so that's a good answer, but it falls under the parenteral. So other than parenteral, all of them, they should be sterile products, like intrathecal, intramuscular, subcutaneous. But other than those, are you aware of any routes that should be sterile, though it could be not a parenteral administration? Okay, inhalation, excellent. Yes, go ahead. Eye drops, excellent. So eye drops, they should be sterile preparations. And that's why sometimes you need to formulate the medication into a liquid form, because like eye drops, it's a liquid form, though it has to be sterilized preparations. So all of that, this is just an introduction to set up the stage where we can look into each one individually, and I will share some examples with you. So if we look into the big picture here, type of dosage forms can be classified based on two categories, or into two different categories. Very much they overlap, and very much whenever you cover one, you will be discussing the examples of the other. So what are these types or classifications basically? First, you classify it based on the route and the method of the administration. So I want to administer an inhaler. Or administer the medication as an inhalation. It could be nebulization, it could be inhalation. I want to administer it as parenteral through the spinal cord, so it's enteral, it's an intrathecal. I want to administer it as, for example, intralesional, so that's into a specific sac or a specific area that is not directly to the veins, for example, and so on. The other classification is based on the physical formulation or physical format of that medication. So when we say it's a solid dosage form, can you give me examples of that? solid dosage form. So tablets, capsules are all solid dosage forms, basically. When it comes to semi-solid dosage forms, any ideas? No, powders would fall under the solid dosage forms, basically. I didn't hear you. Chewable tablet. Chewable will fall also under the solid dosage forms. Suspension? Yeah, excellent. Suspension is an example of semi-solid because it's a mixture between a solid with another diluent or a solid, so that will be suspended. That's a good example. Someone mentioned something here? Okay. The creams and ointments and all of these topicals are example of semi-solid because they have a solid component in that, and they have a vehicle that can have certain type of or certain degree of viscosity, and based on that viscosity, the formulation will be semi-solid. Okay. The liquid dosage forms, again, all the liquid preparations when it comes to oral preparation like syrup, elixir, suspension, as well as the ophthalmic or otic, the ear drops. All of these are liquid dosage forms, and the gaseous dosage forms are basically inhalation. Excellent. Inhalation, aerosols. Those are all the gaseous liquid dosage forms. Okay, so this is exactly what we've just discussed. Another example of the semi-solid are the gels, the paste, the suppositories. Those are another examples. Okay, so we'll start with the solid dosage form. Basically, those products are given or provided with a definite shape and size, actually. You can define that tablet from its size. This is oval, this is round, this is rectangular, and so on. And they have definite size as well, so it's measurable or volume. 90% of all dosage forms that are provided as a solid dosage form are being used for a systematic administration, which is the oral dosage forms, basically. The oral dosage forms are directly absorbed through the gastrointestinal tract at varying rates, and we'll mention how does that happen, with the exception of the medications that are absorbed in the buccal cavity. So, example of medications that are solid dosage forms and they are oral tablets, but they are not to be swallowed, are the buccal tablets and the sublingual tablets. The chewable, for example, this is a very good example of a tablet. It's an oral dosage form, it's a tablet in formulation, it's a solid dosage form, but it has to be chewed first and then it will be swallowed. And the reason for that is to activate the inactive ingredient or the formulation so it exerts its effect and facilitate the absorption inside the body. So here are some examples. For example, lozenges. Anybody who's familiar with lozenges? Okay, so lozenges are basically formulation that they are solid dosage forms. They are intended to be placed in the mouth and to be not to be chewed, but it will. Yes, it will be chewed, not to be chewed. Actually, it will be placed inside the mouth to exert a local effect. So it's not to be intended to exert a systematic effect. So that's why we were saying 90% of the oral dosage forms or solid dosage forms are to produce a systematic effect, except few of them. This is one of the examples. The lozenges are to exert a local effect, which is most likely will be anesthetic effect. Anybody is familiar with Cepacol, lozenges, strepsil, for example. So that's basically is intended to exert its local effect, and it's not intended to exert a systematic effect to be swallowed and to have an action in the GI. It's mainly formulation of or combination of anesthetics like benzocaine and others, and it's a solid, very solid and hard, with some antiseptic sometimes, just to produce a local effect. So that's one of the examples. Here, how does it look like? The tablets comes in all different formulation or shapes, the powders and the granules. So do you see any difference between powders and granules?
No.
Okay. Do you think powders would be a dosage form that we take internal or for an internal use?
Yes.
Any examples? Okay, so some of the preparations that are in so to start with, there is a difference between granules and powders. Granules, usually it's larger in size, and most of the time they are produced in a way, or they are shaped in a way that it has some coating for the inner medications or the inner active ingredient. So it protects this active ingredient from different environmental factors, from the GI, for example, sometimes GI secretion and the acidity. Yes.
And even after we dissolve the solution,
It depends. Yeah, it depends basically. No, and at that point it will dissolve completely. So some granules, for example, is only for masking the odor, basically, masking the odor and the taste. So they formulate it in a way that it will dissolve definitely when it's mixed with diluent, but at the time of the administration, it will mask the taste and the odor of certain medications. Some medications, they have little bit little bit stingy or kind of unpleasant odor or taste. So that can be one of the ways they minimize it to increase the compliance of the patients. Other medications, it's because of its property, like fibers, for example. So fibers, most of the fiber formulation, they come into a powder formulation or granules. These preparations, they will be activated once you dissolve it or you dilute it, and at that time it will exert its effect. We'll go into the powders and more explanation shortly. One last thing about solid dosage form is the suppositories. And suppositories will also discuss that it has different routes. Some of them are vaginal, others are rectal. So it really varies, but basically these medications, it's a solid dosage form, and some of them are to produce a local effect, others to produce a systematic effect. We'll see some examples shortly. So let's have just more details about the different type of oral formulations. The tablets, the one we see here in the top, it's basically a powdered medication that has been compressed into a special form and shape and size. Do you see this line here? Anybody has an idea what do we call that? It's basically a scored tablet. A scored tablet, it's going to be used. This is an indication that this tablet can be broken into half. And I will tell you why this would be important, especially when counseling patients or when selecting the medications. So some medications will come into a 25 milligram strength, but your patient needs only 12.5 milligrams because you want to adjust it for his renal function. Some formulation would allow you to do that by just scoring the tablet. Others formulation comes into a format that you should not really score the tablet or crush it and dissolve it. And in that situation, you need to use a different formulation for this patient, like liquid formulation, for example. So do you see the importance of knowing these, just a few small things? I think it would make a difference when you are selecting the medication for your patient. Yes?
What about if we make it before the
Okay, that sometimes is possible. One important thing is these medications, usually there will be a distribution of the active ingredients. So medication like the one here, the second one, I don't know if it's very clear, that is a coated medication. The coated medication I will show you shortly. The core of the medication is formulated into the core of that tablet. So it's not fully distributed among all of the, into all of the tablet shape or size. Some of these medications which has a scoring, yes, they comes into 4 scores, or they can be scored into 3, some of them, like theophylline, if anybody have seen it, it comes into 3, it has 3 scores. Others are not, so that would give you an indication that this medication can be crushed in case it's needed, or you really need to use the oral liquid dosage forms that are available, especially for pediatrics who cannot swallow. Another example, which is the caplets. The caplets, and if you notice, it's a part of each. It's a capsule because it's a capsule format, I should say, and it's a tablet at the same time, because capsules basically are different. Capsules, they have a gelatin shell around them. So this is, again, it's a solid pill, and sometimes they are coated, but to be easily swallowed. So it's formulated into a small tablet where it's easy to be swallowed. Still, some patients would not find this suitable for swallowing, especially patients with difficulty in swallowing. So then they have to move to a different formulation and use a liquid formulation. Any question? So tablets, they come, by the way, they are not all of them round in shape. They can be triangle, they can be of all format. But there's something called film-coated tablet. Film-coated tablet means the tablet has a shell similar to this one here, to mask either a taste or to mask the color, for example, or to mask the odor sometimes. So that is not considered a contraindication to break the tablet. Other tablets will be in an enteric coated format. Enteric coated format means your medication is designed in a way, it's a system by itself. It can be a different layers, that one layer will be dissolved or released before the other, and so on. And that's where the extended release tablet comes to as an example, for example. Let me go back to the previous one, just to finish here. So tablets or oral dosage forms can be in form of tablets, and that can be in different shapes. And some of them are scored, where you can break the tablets into half, and some of them, they can be crushed and dissolved. Tablets comes into a form where it's easier to be swallowed. It's in a form of capsules, but it's a tablet at the end of the day because it's a compressed powder as well. Enteric coated tablet, these are coated medications where they will be formatted into layers. These layers will release the medication at certain either time or location, as we will see shortly. And those usually should not be broken into half, should not be splitted or crushed, because you are destroying the whole system that is built inside this tablet. Those tablets usually are intended for delayed release or delayed administration, and we'll see that shortly. The capsules are a little bit different. Capsules there are hard gelatin capsules and there are soft gelatin capsules. The soft gelatin usually, they are filled with a liquid, and that liquid is most of the time is a viscous liquid. So it could be because of the solubility. This medication is insoluble, so they could not formulate it into a tablet, for example. Or it could be, again, the odor or the taste of that medication. So it has to be formulated in a capsule format, so it can protect the medication and at the same time allows a palatability or improve the palatability of the patient. Some of them They will have a small pellet. Have anybody seen it before? Anyone have seen omeprazole capsules, for example? Okay, so omeprazole capsules and many others, basically, they have a small pellets inside. Those pellets are the one that contains the active ingredient. And what is the purpose of that? Again, because these medications are formulated very similar to the enteric coated tablet into a small pellet where it will be released in certain location or at certain times after the ingestion. So it's not to be not to exert its effect immediately. Um, Again, that sometimes is to protect the medication from a gastric acidity. So it will reach to the intestine, for example, or the appropriate part of the body, and then it will exert its effect. Not always it's because we want a delayed effect. No, we want it to reach to the right location of the body to exert its effect, or to avoid destruction that medication if it's affected or by the influence of other factors like the gastric acidity. The lozenges is what I just explained to you. Again, it's a flat, round tablet. Most of those comes like with a flavored additives, so it will be kind of acceptable for the patient because it will be left in the mouth for some time until it dissolves completely. Uh, Okay, so here we comes to the chewable tablet. The chewable tablet, the same idea. Some tablets will, chewable tablet, you will find it more in preparation for children or a preparation that the medication should, formulating it as a chewable tablet will facilitate its absorption. So it's either or. But many of those are like the multivitamin, the chewable tablet multivitamin for pediatrics, for example. Um, some medications, anti-allergics for pediatric, instead of them taking the liquid formulation, there are some chewable tablets. Some of the anticonvulsant also comes as chewable for pediatric patients. There is a very special one that is the dispersible tablet. Dispersible, from its name, you add it to you add it to a liquid, so it will be dispersed and dilute, and then it can be swallowed. Again, this is an example of certain dosage forms where they will be formulated as a solid dosage form, but you have to dissolve it in order to administer it to the patient before administration. So it will be in its active form. This is a very interesting example here, gelatin coated tablet. So in few cases, for example, some medications, again, it's either because of the taste, because of the odor, or because of the physical property of the medication, you want to have a coat on that medication, so it will not be affected by the body fluids or other factors, and it will exert its effect in certain side of the bodies. Vaginal tablet, I listed this here just to show you that some tablet formulation are not for oral administration, and that can be the case like the vaginal tablets. The buccal basically, it's a form of a tablet. Usually it comes in a smaller size because it will be placed at the cheek side between the teeth and the cheek. That's the main location. And the intention of that is to administer either, or to provide either a local effect, like steroids, for example, corticosteroid, if there is a certain mucosal conditions, they would apply a buccal tablet. Others are really for systematic effect, but they are easier for the patient. So patients who cannot swallow, the buccal administration will be another way of administering a medication to them. The most important here is that this formulation is applicable for buccal administration, because some of them are not. If it's a hard gelatin, like this one, or it's a sugar tablet, that will not dissolve if you place it into at the cheek, for example. So it has really to be formulated as a buccal tablet. These are the capsules. I think we've covered that. So usually they come tasteless, odorless, easy to be administered, especially the small size, and it's attractive in appearance. Most of them comes in colorful colors. They are easy to handle because they are not so bulky compared to other tablets. As I mentioned, there are hard gelatin capsules and there's soft gelatin capsules. Those can still be either filled by powder or filled by pellets, small pellets. Here, those are filled by liquid formulations. It's very important. Sometimes we get questions like, okay, this medication, the patient cannot swallow the capsules and it's only available as a capsule. Can we open the capsules? We have to put in mind some medications are irritant to the oral mucosa. So if you aspirate it from the capsule, it might be irritant, or it can be even insoluble. So not the fact that it's a liquid formulation inside a capsule that always we can aspirate that. That's not, that could not be an appropriate practice. Okay, here is the buccal and the sublingual. Again, the buccal is to be held between, similar to that, between the cheek and the teeth. The sublingual is to be administered directly below the tongue or under the tongue. And usually this will exert a direct absorption, systematic absorption. Do you know any example where medications can be applied sublingual?
Melatonin. Melatonin.
Melatonin, okay. Any other example? Okay, nitroglycerin for MI, myocardial infarction. What? Yeah, nitroglycerin is one of those good examples where medications, where the tablet, it's a very small tablet, by the way. It's really small. This is example of the bottle. It's usually pocket size or even very small to be carried in the pocket. And the tablets are so small, it's going to be placed under the tongue and exert its effect immediately because of the systematic absorption. So that's one of the examples. The buccal usually is, it's different from the sublingual. Sublingual because its location actually will help in systematic direct or immediate absorption, where the buccal, usually it's designed not to disintegrate immediately, but to slowly release the medication over some time until it dissolves completely. So most of the time, these are for local effect. Few of them are also still applicable for exerting an internal effect or systematic effect. Okay, here is example of the coating of those pharmaceutical. We've mentioned the sugar coated, the film coated. So this is example of a sugar coated. This is the core where the medication is placed, and all of that layers are different layers of different inactive ingredients to protect the medication in the core. So breaking that kind of tablet or crushing these kind of tablets will destroy that system, basically. And most of the time, these medications are placed in that inner core. So it allows, even in the pharmaceutical preparation, that different ingredients which are incompatible together to be formulated together in that kind of preparation. It's a very common thing in multivitamin, minerals, and many other medications. They comes as a coated, sugar-coated tablets. This is just more illustration on the modified release. So, for example, the extended release tablets, or those which we want them to produce the effect after a certain time or at a certain location. We call them modified release medication delivery. Some of them are called extended release, others are called modified release. You will have, anybody have seen any extended release? Do you know what are the letters usually written on these boxes? So if, for example, I will say carbamazepine, the anti-epileptic, this is an extended release. Anybody knows what are the letters? Okay. They would have two letters, XL, the letter XL, or the SR. SR stands for sustained release. XL stands for extended release. It could be LR, which stands for prolonged release or long acting. So it varies from preparation to another, but these are the general formulations. So if the pharmacist, for example, tells you, or you call the pharmacy and you ask what are the carbamazepine preparation, they will tell you we have the CR, which is the controlled release, and we have the regular release. So that CR means it's a long or prolonged action. It has a prolonged action. Here the examples, these are just two examples I had here. Extended release nifedipine, for example, and diamicron modified release. It's very important to know that extended release and or prolonged release, it's not necessarily that these will be given once a day. The notion here or the intention here is that you extend the release of the medication over a certain period of time. So the first hour will release certain amount, the second hour until you cover the 24 hours, or it could be even longer. But some of them, they are designed as such. However, they still need to be administered twice daily. At the other side, we have medications that they have to be only once daily. So whenever you are faced with extended release and sustained release, you really need to know which product are you using, because the dosing will be different. So some of them, they have to be only once daily, others they can go for twice daily, though they are controlled release. Here, the control or the modification of the release, probably it's because of the site rather than the time. So that's why it can be given more frequently. So knowing that as a background will be important for any practitioner or prescriber to select appropriate dosing and appropriate formulation. So why do we use modified release? Some of them are irritant to the mucosa, like the aspirin, for example. It's an enteric-coated tablet. Have you seen any aspirin tablet? Okay. It comes with an enteric-coated, just because of the fact that it's irritant to the stomach, so it will be released in the intestine rather than the stomach. Some of them will be destroyed by the pH of the GI. So you want them to be protected in that layer or in that coat until they reach the intestine and they can be released there. We know that the pH is different between the intestine and the stomach. Drug causes nausea and vomiting if they are released in the stomach. Some medications, they have this as a side effect, and if it's formulated as a tablet, as a regular tablet, it might cause that kind of side effect. So to avoid or to mask this side effect, it will be released, it will be coated, formulated as a coated tablet and released to protect from these side effects. Drugs to be released as an undiluted with a high concentration in the intestine. I can't think of an example, but basically you want the focus, for example, like methylamine. Well, medications for management of Crohn's and ulcerative colitis, those could be a very good example where your site of action is mainly the intestine. So you want the higher concentration and the effect to be exerted there. So some of these formulation can be in a form of coated tablet or modified release. Just one thing to mention here, the conventional formulation, when we mean conventional, it's the tablet, the regular tablet or capsules, which doesn't have a special modification on its release. Those will give a rapid and complete release immediately after administration. However, it will give you fluctuated blood levels. So After it's been absorbed, now it reached to the distribution. So I have a peak level, and then that peak level will decrease over time. And then we have like a trough level or the lowest concentration. So you will have that kind of fluctuation in the blood levels. For certain medications and conditions, you want to have a sustainable level of the medication in the body throughout the day. So an example of that is the PPIs, the protein pump inhibitor, or the medications used as an antacid like Losec, omeprazole, esomeprazole, pantoprazole. These medications are given once daily in most of the cases, and they are some of them in the form of sustained release or modified release formulations. Requires frequent doses because you have this kind of fluctuation in the blood level, so you need frequent doses. On the other side, if you have a constant level, so you need less frequent dosing. It could be an issue for compliance for some patients if he has to take the medication 4 times a day. So at that point, he will come to you, doctor. It's very difficult for me to take this medication like 3-4 times a day. I need to change it. So at that point, you might think of a long-acting medication that can be given either once or twice daily. It probably help in compliance. Okay, so still we are in which formulations? The solid dosage forms or semi-solid?
Solid.
Excellent. So powder is another formulation. I think we covered most of the points here, but again, it's a dry solid substance, consists of a large number of fine particles, and they are divided particles. Some of them, and mostly powder, and this is where it comes to one of the advantage of powders, especially when it's intended for enteral administration, that it can cover a large size, basically. They can be shaped in a different dosage form, like granules, tablets, capsules, suspension by itself, or dry powder inhalers. Even the inhalers, their main formulation here is a powder, some of the inhalers, the dry powder inhalers. Most of the time, powders will be mixed with other inactive ingredients, and powder by itself can be the excipient in the medication, or can be the inactive part of the medication or the formulation. The advantage, when you have a powder, you know the sachet. Have you ever seen a powder formulation that is taken oral? Anybody? Many of the constipation medications are formulated into a powder to be dissolved immediately before the administration. And one of the reasons for that is because of their chemical stability. So as long as they are in a powder form, they will maintain their stability. And then once it's dissolved, it has a certain limit. And after that, you have to discard the liquid formulation or the preparation you have prepared. Example of that are also medication like fibers. Many of them comes in a powder formulation. Antacids sometimes they comes into a powder formulation. It comes as a pack or pouch or a sachet. So you just pour it and dissolve it in a water. What can be the disadvantage of that sometimes? If I tell you this sachet or this pack has 2 grams, and I have a pediatric patient who needs 1 gram, how would you deal with that?
Take half of it.
Mm-hmm.
Take half of it.
Yeah,
Spread.
exactly. Taking half of it might not be really an accurate measurement, because this sachet usually comes as 1 pack. As a patient, it's going to be very difficult for them to know where is the half. And then there is a risk of taking higher or lower dose at certain points. So usually if that is not really appropriate as a strength or as an amount of medication, then you need to think about other formulations. So that could be one of the cases you might face. As an advantage, again, as I said, it maintain the medication chemically stable until it's dissolved. It has a rapid dissolution rate, so once they are mixed, they will be dissolved. The disadvantage here, some of them, they might have an unpleasant taste, and that's difficult to be masked. That's why some of them are produced or are formulated as granules to mask this taste or this odor. Others can be irritant to stomach, so so that can be a disadvantage. In this situation, you would prefer to give an oral tablet or oral capsules from the same medication. It's very important that powder can be used for enteral administration or systematic effect, and some of them are for topical, for example. Topical, just like the dusting powder, talc powder. Do you know any application for talc powder other than topical external administration? Talc is one of the sclerosing agents. They use it as a sclerotherapy for what they call it, sclerotherapy for into the pleural side. So that's one of the administration of a powder as an internal, but it comes as a sterile powder with a special canister, special formulation. So sometimes, or the dry powder inhalers, like the inhalers, they are powders, but they are a sterile formulation, and they are formulated into a microfine powders where it can be administered directly to the lung. Example of medicated powders like nystatin or any antifungal powders, the bulk powders like the oral fibers, medications for constipation, and again, the inhalers. Okay, so here we reach to the topicals. So topicals would be a form of solid dosage forms or semi-solid or liquid dosage forms. What do you think?
Semi-solid?
Yes. So most of them, they falls under the semi-solid. Some of them could be a solution or liquid formulation, but most of them, they would be a semi-solid. And here, we have the ointment, creams, foam, gel, paste, liquid form, like solution, suspensions, when they are mixed in an aqueous solution or emulsion. And some of them, they have a hydrophilic or hydrophobic properties. They can be applied directly to the skin or to the other surfaces like the lung, for example, like the dry powder, like the aerosols. Or they could be applied like to the eyes, for example, or otic preparation directly to the ears. So again, they can be used as topical for direct administration or systematic drug delivery. One of the important drug deliveries here for topical preparation or administration is the transdermal patch, and we will learn shortly about that. So, what is very similar between, have you ever, for example, seen a medication, but it comes into it's a topical medication, but it comes into a different formulation. So one of them can be a gel, one of them can be an ointment or a cream. So have you seen anything like that before? Okay, yes, it comes as a gel and an ointment. Do you think there is a difference here, or one would make a difference? How would I choose for my patient? Should I use the ointment, or should I use, it's the same active ingredient, like many of the steroids, for example, the corticosteroid, you might see betamethasone ointment and betamethasone cream, or hydrocortisone ointment and hydrocortisone cream. So how would they choose which one I should prescribe for that patient? So they are very similar in consistency, most of them, in presentation, how they are preserved, what are the preservative, the inactive ingredient, and so. But these dosage forms would differ in some properties, which make it the reason why I select one but not the other. It depends on the vehicle. That vehicle can be a hydrophilic, so it's more of um, water-based, or lipophilic, so it will be more of a lipid-based or kind of hydrophobic base. Here, this gives you just a spectrum. How does it go? The hydrophilic, which are the water-based, and then that will decrease basically, and until we reach to something to products like the Vaseline, for example, or the petrolatum. So here we have the water. It has a high water solubility. It's a water basically, and then followed by lotions, and then followed by creams, and then followed by ointment, and the last one is the petrolatum. Here we can see the lotion toward the lipophilic, the lipophilic, and that means the base here is more of a liquid formulation. Then the cream, it's in the middle. The ointment is more of a greasy. Even the texture, you will find it different. So if we differentiate between the three, the ointment is not easily absorbed. So if I formulate a medication within an ointment base, basically, it's not going to be easily absorbed. And it has low spreading ability. If you want to spread it on the body, it will have low spreading ability because of its high viscosity, basically. However, there is one advantage, an important advantage, that it will remain longer time. The intact time on the skin is longer. So which side of the body you think this might be an important property, or which condition this might be important? Any thoughts? If I have a preparation that is in form of lotion and others in form of ointment, let's look into the lotion. How does it look like? It's readily applied to the skin. It's very easy to be applied and to be spread on the skin. They have the advantage that it can form a thin layer, so it's not even cosmetically, it's more acceptable for some patients, and probably even economically, because it will cover larger area of the skin. However, when it comes to the stability, that could be shorter than the ointment and creams because of its intact time. So any idea, any reason why I would choose cream or ointment or lotion? Okay, so basically for the very dry location or dry part of the body, usually you want something that will last longer, and ointment in that situation can be selected. In others, especially cosmetically, when you want to apply it on the face or an exposed site of the body, you probably want to select something like lotions or creams as applicable, because that will have a higher spread ability, and it can be spreaded easily, and it will not be greasy as well. Yes?
What's the difference? Like if you get a burn, you usually use it all. But then if you get like a rash or something in the same area, you use a cream.
Okay, that's a good question. So the burns here, you are using the ointment for the burn as a barrier, basically, because of its ability to stay on the skin for longer time, and it will form a protective effect. That will be the main mechanism or the main reason I would use an ointment in that site. When it comes to rash, for example, or fungal infection or any other type of conditions, here you would like to think about the absorption of the medication, especially when it's with a medicated preparation. You want to consider also if it's appropriate for that to be covered or not. So mainly it's the absorption here, what will make it a difference that I will choose a cream or because the absorption will be higher from this formulation. And the ointments or the greasy ones, usually they will have a higher time or contact time and more protective layers in that situation. Okay, we'll reach to another modality of a topical preparation, but it will produce a systematic effect. It's called the transdermal patches. Any idea, anybody has seen that or heard about a transdermal patch? Okay, so basically, some medications, they could be difficult to be prepared into an oral administration, for example, or would require a delayed effect or a delayed release. So we want to produce it in a way that the patient will have a continuous release of this medication over a period of time. That could be a good example for formulating a medication as a transdermal patch. Basically, it's a self-contained dosage form that is designated to deliver the drug through the skin to produce a systemic effect. So it will produce, it will reach to the blood circulation or to the adipose tissue based on the formulation of that medication. Mainly, it will be in form of layers. The layers here will be different layers where it will control the release of the medication over a certain period of time. Some of them, they might even last for a month. You might apply it for a month period. Some of them, you might apply it for 3 days, for 24 hours, or for a shorter period. Any idea why would I use transdermal patch, or how would it make a difference for a patient, for example? Yes.
I can use the brush if I want to cover up the area.
That's different. Here, you want to exert the effect systematically, not to the topical side. So this is a very good point you are bringing. Now, patch, the transdermal patch, we're speaking here about a medicated patches, where it will have the medication formulated and sticked into that patch to produce a systematic effect. When we apply a lotion or ointment or creams, here we are applying or we're looking for the topical effect or the direct effect. So that's a very good point you bring up. They are mainly given or formulated and such to provide a sustained drug delivery. In certain conditions, you really want to have a sustained, non-fluctuating blood levels to control the condition. So that would be an excellent way of administering the medication to improve patient compliance. There are some of the Parkinson medications that are given very frequently, and then now there are some formulations. Some of these medications are formulated as transdermal patches. For those patients, it will be definitely an advantage because you have to take it like 6 times or 5 times a day. Then that is a formulation that to be applied once, probably every 24 hours or 48 hours and so. Some of them can be useful for patients who cannot swallow, basically, or they are unresponsive or comatose, regardless. So the patient cannot take an oral medication, so that can be a way to administer the medication. Very good example of transdermal patch. Some contraceptives comes as a transdermal patch, and others like pain medication comes in as a transdermal patch. So there are nicotine patch, for example, comes as a nicotine patch. This is how it looks like. So the medication is embedded here, basically. And then you remove the layer and you place it. The application of this, the patch, it will vary based on the medication, but here are just the common sites where where the patch can be applied, either on the hands, the shoulder, or either at the abdominal site as well. Okay, so now we'll move to the liquid dosage form. Liquid dosage form basically falls under a new category. So we finished the solid, the semi-solid, and now we're moving to the liquid dosage forms. Here, the active ingredient is dissolved into a solvent, and that solvent can be of different types. Examples: solution, emulsion, suspension, extracts. They can be used for internal or external applications. As we said, some of them are just for the direct administration on the body or the skin, and others are mainly for, and that's the majority, is for internal use. They can be sterile, like the ophthalmic, or non-sterile, based on the route of administration. They're very suitable for pediatric patients, patients who cannot swallow tablets or solid dosage forms. They should be formulated to be acceptable in color, viscosity, and odor and taste, because if it has a unpleasant odor or taste, this will decrease the compliance of the patient. This is just a matter of comparison here between the absorption of the aqueous solution. So, as I mentioned, the liquid formulation here, the active ingredient is dissolved in a solvent, and that solvent can be an aqueous, like a syrup, for example, or can be in a form of a suspension. So here, the absorption from the suspension will be less because of its formulation, and the tablet will be the least, the tablet and the capsules. So that when it comes to the absorption rate comparison. If you can see, usually the syrup are more clear and non-viscous or less viscous. When it comes to the suspension, it's more viscous, and this is because it's more of a semi-solid. It has an active ingredient that is dissolved, not completely dissolved in the liquid, because of the property of the medication. That's the reason. Yes.
There's some drugs like this one suspension have a when we buy it have a powder.
Mm-hmm.
Yes, and then we add the water,
Mm-hmm.
and it will look like this.
Exactly.
That's what considered liquid or powder or solid.
It is a liquid formulation, but it's a semi-solid liquid because it's a suspension. The right terminology here is a suspension. So it falls under the liquid or the semi-solid because it still has a solid part of it, but it's formulated into a suspension. Suspension, by the way, means not all the particles are completely dissolved. And unfortunately, I didn't put a picture for that. It will be like, if we look at the syrup, all this solute or the particles will be completely dissolved. When it's a suspension, you will still have these dots, seeing that as a picture, as an illustration. But the medication is activated, so it can exert its effect. But it will not completely dissolve in that liquid, because of its property. But once it's ingested, it will produce its effect. But it's a suspension, that will be the right terminology. And the reason some medications are formulated into a suspension, because these powders have certain stability, chemical and physical properties, so they will remain as a powder or a solid powder. And once it's needed, then you can prepare it. If you notice, for example, most of the antibiotics, their stability, it will tell you, once you prepare it and you start using it, it's good to be used for 7 days, 10 days, and then you discard it. That's because of the stability of the medication. So it was as a powder, it was kept stable. Now you prepare it, and now you can use it for a limited period of time, and then the medication has to be discarded, which is usually the course of the antibiotic. Okay, so now we'll move to the gases or the inhaled dosage form. And these are basically a drug product that are packaged under a pressure or pressurized type of formulation, where a product will have like a holder as well as a device to release the medication from that device, usually. The medication can be delivered in form of aerosol or in form of gas or in form of a very ultra fine solid particles or powders that can be deposited directly to the lungs. Mainly, those are being used for the administration of direct administration to the lung or pulmonary conditions, mainly the respiratory diseases. As a names, if we want to differentiate between the different formulation, we have nebulizers, we have powder aerosols, the dry powder inhalers, we have pressurized meter dose aerosols and sprays and inhalers. I'll show you all of these shortly. Basically, the gas inside that preparation will maintain or restore the medication property until it's been activated by pressuring or by activating the valve. We'll just see that shortly. So, for example, this is a dry powder inhaler, the one over here. There is a canister, and this canister, so the medication is pressurized. It's a dry powder inhaler. It's pressurized, and it will be released as a very ultrafine or an ultrafine particles that will be deposited directly to the lung. It will not be activated until that system is activated, and we'll see that shortly. Some of them, they comes in a form of a pellet or a tablet, and that tablet will be inserted from here, for example. So this is called discus. The discus is, again, it's a device that will administer or contains a medication in a form of dry powder, and it will activate it into once it's activated, or it will release it once it's activated, and it will be administered directly to the lung. These are different type of inhalers. So all of these are inhalers. If we want to have a general name, all of these are inhalers, but the way of the administration could be a little bit different, and I will show you some examples here. Some of them you need, can you see here, these are the capsules. You have to insert it into the device, the inhaler, and then the patient will activate that inhaler and administer the medication. I'll show you just a very quick, I don't know if it will work.
Good grammar and spelling are important, but if you want to write essays that inspire, messages that forge
just to show you how these.
People who have lung conditions like asthma or COPD often take their medications using a handheld device called a metered dose inhaler, or MDI. A metered dose inhaler sprays medicine through your mouth so that it can reach your airways. If your inhaler is not used the right way, some medicine may not enter your mouth, or some may remain in the back of your mouth. Either way, it may not reach your airways where it is needed. This video will show you the general steps for using an inhaler correctly. It's important to follow the instructions that came with your metered dose inhaler.
Okay.
A metered dose inhaler.
That's fine.
Has three main parts: the mouthpiece cover, the plastic sleeve with the mouthpiece, and the medicine container.
So this is basically powder or ultrafine powder.
Before using your metered dose inhaler, remove the mouthpiece cap and shake the inhaler. If this is the first time you are using your inhaler, or if you haven't used it in a while, you may need to prime it.
See, what comes out is really powder, and that will be deposited into the lung.
They can differ depending on the type of inhaler and medicine. When you're ready to use your inhaler, stand or sit up straight. Breathe in deeply and breathe out completely to empty your lungs. After shaking the inhaler, put the mouthpiece in your mouth and close your lips around it to form a tight seal. As you breathe in through your mouth, press down firmly on the top of your inhaler to release one puff of medicine.
Okay, we'll stop here. Can I go to the again? So is it shared now? So basically, I just wanted to show you how this medicament or this powder will be pressurized powder and will be released directly when it's activated. So that kind of puff is the activation of it. This comes in different modalities, and each one should the patient should be educated how you should administer it. But the idea here is some patients might not be able to squeeze these devices. So if you have an asthmatic or COPD patient and he has rheumatoid arthritis at the same time, he has pain in his hands and they can't really squeeze it. There are different ways to administer these medications. Some of them, like this one, for example, the patient just need to rotate to activate it rather than pressuring the device. So all of these kind available, and it will be customized to the patient based on how they can take the medication the best way. Okay, we'll move to solution. Here, probably we've covered most of that, but just to give you focus on the ophthalmic and the otic solutions. Again, they are solids or liquid that are being dissolved into another liquid, basically. Some of the other aqueous solutions, other than otic and oral and ophthalmic, are the douches, for example, the enema, the gargles, mouthwash, and nasal solutions. So the douches, for example, they are it's a kind of a liquid preparation that will be directed against the part or the cavity, a body cavity that you want to produce that or to produce the effect in that part of the body. Either most of the time they are being used for cleansing or antiseptic effect. Example of that is the eye douches, for example, or the vaginal douches, the pharyngeal douches, and the nasal douches. So you want to direct the effect, the cleansing effect or the antiseptic effect to a specific part or cavity. The enema, anybody knows what's enema? Okay, so enemas, they are liquid formulation, and some of them comes as foam, by the way, but they are to be administered through the rectum or rectally. So these are solutions administered rectally for the local effect or for systematic effect. So they can do both. Some of these medications are formulated as enema because you want to produce the effect in that location, like in Crohn's disease, for example, in ulcerative colitis. You want the effect to be localized for these patients. In other situations, sometimes because the patient can't swallow tablets. Any example? Mm-hmm. Okay, so some medications you want, for example, someone in case of constipation, we have different modalities to treat constipation. We can take oral tablet that will produce an effect in the stomach, or in the intestine, or it can be administered. A solution can be administered as enema, for example, or suppositories, which can be also administered as rectal administration. And in that situation, it will cause or it will produce a local effect. So the other type of solution, which can be not really for oral administration, is the gargles and mouthwashes. Usually, most of these are for antiseptic effect, so a cleansing or antiseptic effect. Some of them are for treatment, like when you have antifungal, for example, medication to treat fungal, and they are being used as a mouthwash to treat an oral thrush, for example. Nasal solution, it's clear from its name, it's to be applied directly through the nasal cavity. Some of them are medicated, so it contains an active ingredient and it has an effect, like decongestant or vasoconstrictors, for example. Some of them are more of a cleansing, antiseptic effect, and so on, like normal saline, for example. Back to the rectal formulation, again, these medications to be administered rectally for local rather than systematic effect most of the times. They can be delivered and inactivated by the gastrointestinal fluid when administered orally. So in order to skip that route, it's administered as a rectal dosage form. They comes in a form of enema. They comes in form of foam solutions. They come in form of suppositories. And here are the different types and different sizes, different shape of different suppositories. Those are suppositories, and this is an example of an enema. It can be here just an example. The enema, by the way, there are multiple type of enemas. Some of them are called retention enemas. So the retention enema, basically, you want to maintain the effect for a certain time. So it will be placed for like 6 hours, 2 hours, 3 hours, based on that medication to produce a continuous effect for a certain amount of time. And others are to be administered only once, and you expect the action or the effect after that within a certain period of time. This is example of mineral enema. If you heard about something like that, fleet enema, those are for the management of constipations, for example. These are the vaginal dosage forms. Again, vaginal dosage forms, sometimes you need a local effect, others rather than systematic effect. Example of that is the antifungal, antibacterial, or progesterone, for example, and hormonal medications. They are formulated into either vaginal suppositories, and sometimes are called ovules, or pessaries. They comes with the devices for administration, or that device can be itself localized, or douches also. These are different, again, another kind of vaginal administration. The last thing is the ophthalmic preparation here. As we mentioned earlier, those are supposed to be sterile preparation, whether it's an ointment or it's a liquid. It has to be sterile solutions. Some of them are in form of suspension. Others, they are very clear liquid. Those preparation, usually they are very adjusted based on the pH of the eyes and the other important properties. Some of them will form a layer, and that layer will be needed for certain conditions as a protective layer, like the ointment. So if you have a patient who has a condition and this medication comes in a drops and as ointment, most of the time the prescriber will prescribe the drops throughout the day, because that can be easily washed out from the eye, and the ointment will be administered at night, so it will stay longer. So it depends really on the time and the action that you are looking for. Is it more of relieving the redness, for example, and the allergic reaction, or is it for dryness of the eye? So you want to produce a protective effect throughout a longer period of time. So these are the examples. This is what we call, anybody knows what do we call this? Okay, so eye drops, these are the eye drops. They come in different ways or different forms or different sizes as well. Some of them are in form of drops, others in form of sprays. So you spray it gently into the eye. It's like a drops. And here, those are the minims. Minims, usually it's the same ingredient or the same medication in the oral, in the bottles of the ophthalmic preparation, but minims comes as a single preparation. It has the advantage that the patient will use a specific amount of medication and then they will discard the others, because All of these drops, usually they have short stability. So after you open it, usually 1 month, and then you have to discard it. But if the patient will use, for example, the minims, he will use whatever he needs, and then the rest will remain. Also, they are handy. It depends, really, it varies. Some medications, they only comes as minims, like the one you use, or the optometry use, for example, they comes because you use it as a single dose, and that's it. Here, there are some ointments. Usually, they come very small. They form a very thin layer into the eye. This is an example of the administration. The last is the otic dosage form. Some of them are non-sterile, aqueous solution. They are administered onto the outer side of the ear. Others, they are installed into the ear itself for like the wax, for example, management of excessive wax. Others are like antibiotics or antifungal. So it varies, really, the reasons why you use otic solution. The last one here I have is the parenteral. And parenteral formulation, if you remember, we mentioned there are 4 or 5 routes of administration. Anybody can give us examples? This is the last slide, so after that we'll recap. Parenteral. So parenteral is the big name, or the main, the master name. And then what are the routes of administration? Intravenous, excellent. 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 Subcutaneous. Intrathecal, that's right. And intralesional also applies to that. So all the parenteral formulation, for mostly it's a liquid that will be, it's a sterile preparation that will be administered through different routes. It varies in the preparation. So some medications are appropriate for intrathecal, others are not. Some medications are appropriate for intravenous administration, but not intramuscular, or vice versa. So it would be very important to know the appropriate route of administration for this medication as a parenteral. So all of them are parenteral, but there are some variations. This variation comes to medication stability, medication property, and many others. But the most important thing is to know what is the appropriate administration route for this medication. The volume sometimes would make a difference as well. Subcutaneous, for example, has certain volumes versus IM versus intravenous, and so on. Here, just a very quick illustration on the differences between the terminology of IV push, for example, and IV infusion or drip. Any idea how is this different, or is there a difference? Okay, so basically, IV infusion, the infusion means there is a larger volume of a medication to be administered parenterally. That can go from 10 ml up to 1 liter, and it varies. This medication will be given at a certain rate of administration, so you can infuse it. An infusion means that this medication will be administered through the veins at certain limits, or certain degrees and rate of administration. So a specific amount over specific time. That's what we call it infusion. And this infusion can be continuous throughout the day, like 24 hours, or can be intermittent, like every 8 hours, you will infuse the medication for 1 hour. And then after another 8 hours, you will infuse it for another 1 hour, and so on. So that's what we mean by IV infusions or drips. These are the terminology you properly will hear. Most of the time, these infusions will be administered through certain pumps. So the rate and amount of medications administered will be controlled by the nurse or by the pharmacist or the physician. They will set exactly how much amount of the medication to be infused throughout the time or over specific time. That's basically when it comes to IV infusion. IV push, it's a different concept. IV push means the medication can be directly administered through the vein over a short period of time, which is usually 3 to 5 minutes. That applies to specific medications. Not all medications are applicable to be administered through that route, either because of their side effect, because of the maximum amount that the veins can take, the pH, the osmolality, too many other factors that will determine which medication can be given as an IV push versus IV infusion. And also, most important is the effect of the medication. So what would be important for you is to know that the parenteral medication can be given through different routes, and even the IVs, they can have a different form or different ways to administer these IV formulations. Here is the first slide, which we discussed. I think we covered most of those. Anyone has any question about this? So basically, the reasons why medications, a dosage form will be selected over another is because of either what action we want to have, what are we trying to avoid, like the influence of the gastric acidity, the influence of the other environmental factors, and so on, or the acceptance of the patient, the palatability for the patient, and so on. And that's it. Thank you very much for your time. If anyone has any question, please feel free.
Doctor, the online students have questions.
What is it?
Doctor, can you repeat suspensions?
Mm-hmm.
Okay.
Okay, so basically suspensions. Suspension is a liquid, there is a question from the online. Suspension is a liquid dosage form. However, there are two different formulations, either solution means the medication is completely dissolved, the active ingredient and the diluent, it will be completely dissolved in that. The suspension, the medication will be suspended into that liquid, and it will this will be based or because of its property, its chemical solubility, and other factors. Both of them can be used either orally or they can be used, some of them are ophthalmic, some of them, the solution can be either ophthalmic, the suspension can be either ophthalmic, they can be liquid for oral administration, or as well, some of them either topical sometimes. So that's the main.
Doctor, what are the main things to focus on?
Okay, I think the reason why would we select dosage forms, different dosage forms. For example, if I have a medication that I cannot administer it, patient cannot swallow tablets. So what would be the most appropriate formulation for this patient that can he take? Something like if a medication to patient has a compliance issue, and I would like to improve his compliance, and he has to take the medication 3-4 times a day. So which formulation would be more appropriate for somebody like that? Is it the oral tablet that has to be given frequently, the transdermal patches, or something like that? So focus on the reason why I would select a specific dosage form. Does this make sense? Okay. Yes.
Yes, Doctor, could you please repeat sustained release versus control?
Okay, sure. So there's a question about the sustained release and immediate release. So basically, conventional or immediate release. So a medication will be in a form where it will rapidly and completely release its active ingredient after administration. And in that case, the absorption will start immediately after that the administration occur. Where in a sustained release, basically, the medication or the formulation will be formulated in a way that it will slowly release the medication over a specific period of time. A certain amount will be released over that time to delay and extend the effect of the medication, or to produce the effect or to produce that release of the medication in certain part of the body, like specific part of the GI, for example. Here in the conventional formulation, there will be a fluctuation in the blood levels, so which is based on the pharmacokinetic of the medication. The medication will exert after the administration, there will be an absorption, and after that, it will reach a steady state or a state where a concentration will be the highest, and then that will start to decrease over time. In the sustained release, there will be a constant blood level of that medication throughout the day or throughout the period where this medication covers. Because of that function or because of that feature, the conventional or the immediate release, you have to administer it more frequently, where the sustained release, you have to administer it less frequently, like instead of administering it 4 times a day, you can administer it twice or once a day. How would this be important? Sometimes it's important to improve the compliance of the patient and the convenience and improve their adherence. Sometimes it's because you want to exert or you want to produce a specific effect for a specific condition in certain site of the body. So it depends, but generally it will improve the compliance of the patient.
Are pessaries the same as suppositories?
Pessers, they are the same, and some of them are medicated, or they will be used to administer some suppositories. Suppositories, we do have different route of suppository administration, like the vaginal, like and the rectal, basically.
Are the conventional formulations same as delayed release?
No, the conventional, maybe I'll change this in the slides when I send it. The conventional here, we means the immediate release. So the conventional is the immediate release. Anything that is called sustained, delayed, those are the modified release. So they will not be released immediately. That's how it.
If enemas are given as solutions, do they produce sustained?
Less likely. So mainly enemas are used for the local effect, yeah, because of their absorption. So it's mainly for the local effect. Okay. Any question from here? Okay. I hope you enjoyed it and you find it useful. Probably there are a lot of information, but it's more, I wanted to take it more of a practical point to think about it for your practice.